I was just so angry. I was so angry because I had been in pain for so long. And I was so upset because they're canceling my surgery. Hi, I'm Carolyn. You're watching Carolyn Getting Fit. And the video that is going to play after this intro is kind of a hodgepodgey mess of all the stuff that I've been going through the past 2.5 years. It's a journey. I hope you stick around because it wasn't fun to go through or talk about, but maybe fun will be right around the corner. Okay, enjoy. So it was in October of 2022 that I really was able to put a word to it and say that, like, yes, I have a drinking problem. I need help. That was kind of all that happened for a while there. Because December of 2022 into January 2023, I had a very bad mental health collapse and the start of a mental health crisis that continued for quite some time. I remember in March, I saw my doctor and I was upset about just a lot of stuff, and I was given an anti-anxiety med, and it took me a couple of weeks to start taking that, to feel comfortable enough to start taking that. And then I did, things got better, but I was still drinking and I was still having issues with anxiety pretty consistently. So that was from March until I want to say about July. I had really, really, really bad anxiety. But also in March, I had the start of an ulcerative colitis flare. In July, I had the start of another ulcerative colitis flare that I needed to be just for the day, but I went to urgent care and I was given several bags of fluid because I was dehydrated. So we're at January 2020, or we're at July 2023 now. And August, I noticed that my right eye started to hurt, and like this eyelid got like really puffy, and then it stopped being puffy, and then my eye started to get really red, and my doctor gave me a referral to a specialist who I wouldn't be able to see until October. And I ended up going to emergency and I was diagnosed with uveitis in my right eye. That was part and parcel to the ulcerative colitis flare that I was going through. And then I noticed in September I thought like the back of my leg, it just itched. So I scratched it, and I scratched a little deep. So I put a Band-Aid on it, and then this bug bite that I scratched too deep is getting bigger and getting bigger and getting kind of gross looking. So I go back to urgent care, and it's an infected bug bite. So I'm given antibiotics, and I'm taking antibiotics for an infected bug bite, and the bug bite's getting bigger and bigger and bigger. It took until November for that to be diagnosed as pyoderma gangrenosum, but we're still in September. Beginning of October, I hadn't been in the hospital. I was so happy because July, August, and September, I had hospitalizations. October didn't have one. And I thought that was so great. I'm finally breaking the cycle. I don't have these problems anymore. I'm getting better. I'm getting healthier. That was really cute because I then just started being sick one day. Being sick. And I couldn't keep anything down again, and I'm being sick, and I didn't understand what was happening. And I went to emergency one night, and I waited there until like 2 o'clock in the morning, and I had just like these really sharp pains in my stomach. And I thought maybe it was appendicitis or something, because like it hurt over here. Like, if you know appendicitis, the things that they do with the touching and stuff, that's what I thought it was. And then when I was at urgent care, or when I was in the waiting room at emergency after I'd been waiting for 4 hours, I broke wind and the pain stopped. So I really thought it was just strap gas, and my head got a little overwhelmed just because with how much pain I've been in lately. And I was so willing to believe that I pulled myself from emergency. I hadn't been admitted. I'd just been in the waiting room, but I said, okay, never mind. That was funny, but it's nothing. I had a doctor's appointment the next day, so I went to the doctor, and like I wasn't feeling good. It hurt like right up here at the top of your stomach, and it hurt all the way down here, like down below. Can't really see where I'm pointing, but you know, in the gut area. I hate that word. But doctor tells me that my gallbladder looks inflamed, and I also tested positive for McBurney's point, so it could be that. I go to emergency again, but a different emergency room, and they did a CT scan, and my gallbladder's inflamed and my large intestine's inflamed. So gallbladder issue led to an ulcerative colitis flare again. Now I was sent to a hospital where they did a colonoscopy and an endoscopy. They found the internal bleeding, because I was bleeding internally. I had been bleeding internally for a while, because my mom noticed that I was sleeping a lot. These are some of the things that even I didn't notice when I was so sick. But they found the internal bleeding. I had a gastritis, and I was internally bleeding, and I almost bled out internally. So I got started on some anti-inflammatory. They elected not to take my gallbladder because, this is the important part, they elected not to take my gallbladder because I was very anemic. My hemoglobin was so low. It should have been at like an 11 or something, and my hemoglobin was at a 7. So half of what it was a point where they got to a 6. I had to have a few blood transfusions because I was so anemic and I'd been bleeding internally. But I got released from the hospital that Sunday, and I tried to go back. So that's after having something go wrong every month. November, they finally diagnosed my leg. So I get out of the hospital. It was end of October. November, my leg is getting better, slowly but surely. They've put me on steroids when it was correctly diagnosed as pyoderma gangrenosum, and it started clearing up really fast. So things are looking up. I'm anemic, and I tell my doctor what happened in the hospital. We're scheduling my surgery for my gallbladder removal. So it won't be an emergency surgery now. It's going to be a scheduled one. I'll get some tests done, some EKG, some blood work, some stuff like that. And I saw a hematologist who prescribed iron pills. I saw a general surgeon who I was talking to about getting my gallbladder removed. And January, my doctor quit the practice that I go to, which he got another job somewhere else. So another doctor from that office is seeing me now, and I don't know him as well. Granted, I'd only seen that other doctor for 2 years, but that's still 2 years that I had seen him. So now I've got this new doctor, And I don't know him. He doesn't know what I've been going through. And because of the iron supplements that I was on and to combat the anemia, I developed a hemorrhoid that was the most excruciating pain I've ever felt. We're now in January 2024. My hemoglobin was so low. It should have been at like an 11 or something, and my hemoglobin was at a 7. So half of what it was a point where they got to a 6. I had to have a few blood transfusions because I was so anemic and I'd been bleeding internally. But I got released from the hospital that Sunday, and I tried to go back. So that's after having something go wrong every month. November, they finally diagnosed my leg. So I get out of the hospital. It was end of October. November, my leg is getting better. Slowly but surely. They've put me on steroids when it was correctly diagnosed as pyoderma gangrenosum, and it started clearing up really fast. So things are looking up. I'm anemic, and I tell my doctor what happened in the hospital. We're scheduling my surgery for my gallbladder removal. So it won't be an emergency surgery now. It's going to be a scheduled one. I'll get some tests done, some EKG, some blood work, some stuff like that. And I saw a hematologist who prescribed iron pills. I saw a general surgeon who I was talking to about getting my gallbladder removed. And January, my doctor quit the practice that I go to, which he got another job somewhere else. So another doctor from that office is seeing me now, and I don't know him as well. Granted, I'd only seen that other doctor for 2 years, but that's still 2 years that I had seen him. So now I've got this new doctor, and I don't know him. He doesn't know what I've been going through. And because of the iron supplements that I was on and to combat the anemia, I developed a hemorrhoid that was the most excruciating pain I've ever felt. We're now in January 20. So I had to get an EKG and blood work done, and I had a little too much iron. Went from too little to too much. And I had a chest x-ray done, and I thought, like, well, if there's anything in my chest, this will find it. And there was nothing there. So I had a little bit of tachycardia. I had a little bit of too much iron, but the chest x-ray looks good. But my doctor is refusing to sign off on the surgery because I have a little bit of tachycardia. And that I was just so angry. I was so angry because I had been in pain for so long. And I was so upset because they're canceling my surgery, whereas like I'm going to be put under for like a good 30 minutes, maybe even an hour, and not be in pain. And now you're telling me that you've canceled that and I can't have that? Well, this should have been a sign that something was really wrong with the amount of pain that I was in. I just was a bit pissy. But that Sunday, I go to urgent care for this pain in my chest. And they do a ultrasound to get me hooked up to, because I have floaters. I'm a hard stick, I got floating veins. But they do some sort of ultrasound on my chest, or not on my chest, sorry. They did an ultrasound to get some of the IVs in, and they do a CT scan, and they see something. There's something there. So then they're going to extract. They extract, and it's pus. They thought it might have been like turmeric, not turmeric, but like tumor fluid or something like that. No, it's just, I have a giant abscess. So they drain it. It's about 3 liters. They give me some intravenous antibiotics. Cool. I got the IV drugs. And then 2 days later, it's 4 or 5 in the morning. I don't know. And I felt something floating in my chest. Like it felt like it had been dragged underneath the skin or something. And so I go back to urgent care, and they punch a hole in my chest that time and put these forceps in, and they pull something out. I don't know what it was, but they pulled something out of my chest. And then they pack it. I go back in a couple days later. They unpack it, and they told me how to clean it. Cool. And then a couple days later, after it had been unpacked, and I had been keeping the area clean, I had been doing all that stuff, it burst. So I go back to urgent care. I get admitted again. I'm losing feeling in my hands, and I'm losing feeling in my feet. And also at this time, I was not myself. If you spoke to my mom and my brother about it, they would tell you that I had been on this huge regression tour, that I went from like just kind of constantly aggravated, annoyed, and angry person to petulant teenager to, my brother said, 5 foot tall baby. My therapist said that this regression is totally normal, especially considering the amount of pain that I was in. But it wasn't, I didn't know, like, I'm not good in the hospital. I'll say that. When it comes to things, I don't like being in the hospital. I'm not good at being in the hospital. So I'm not a good patient. I want to believe that I am, but I know this time I wasn't, because I wasn't really understanding what was going on. Like, looking back at it now, I can see and understand a bit more of why I was doing what I did, but at that time I'd been in pain for months. Like, I hadn't been able to sleep for months, and that's when my chest burst, and my mom and I went to urgent care, and they asked me on a scale of 1 to 10. I said a 7 when my mom's ready to interrupt and tell them it's got to be higher than a 7, because she wakes me up every 4 or 5 hours to give her medication at night, that's what I was doing, because I needed like Advil PM, because I couldn't get to sleep any other way. And my reasoning for saying a 7 is that women in pain tend to not be taken seriously, and I figured even though it was a 10, if I said it was a 10, they would treat it like a 2. So I figured 7 was a good number to come at him with, and it got the job done. It got me listened to, and it helped that I had a giant hole in my chest that I was bleeding from. And I was losing circulation to my hands and feet. And I started having hallucinations. Looking back on it, knowing what I know now, it's obvious I was showing signs of sepsis, and that is why I was admitted. But there was a miscommunication somewhere, and the nurses had no idea why I was in there. Because I don't know what's happening. I'm in med surge, and then at some point on Friday, I'm in psych. I don't know how I ended up in psych. But at some point, I go from being in psych to ICU. And that's when a nurse that I was talking to after things started coming back and I was starting to come back to myself. I had an episode when I was in psych, and I went into cardiac arrest. and I died. I was revived after about 2 minutes because that nurse said she'd lost too many patients and she wasn't going to lose another one. Not young, not so young, not today. So I owe her my life, quite literally. But I had to piece things together from there, because when I woke up in the ICU and my fingers were white, they were white, and if they weren't white, they were purple at parts and red at others. And that's when they're telling me this stuff, saying, like, is this Raynaud's disease in your hand? What are you doing here? Like, I don't know why I'm in the ICU. I don't know why I'm in bed 1. And I didn't know anything. And I was discharged to a nursing home a few days later, still not knowing anything. And I'm still recovering from the trauma that I have from both the traumatic event that was this health episode that I had, and the trauma from the neglect that I suffered in the nursing home. So I'm really glossing over the nursing home in an event to not re-traumatize myself. But I was in a nursing home for 5 days. On a Tuesday evening in March, my mom and my brother took me out of there, and I was a DAMA. It's a discharge against medical advice. And I'm still putting the pieces together about what's happening, because I remember one of the doctors told my mother, we gave her an antibiotic to bypass the kidneys and liver. I didn't understand why that was significant. And I, like, down to the tiny bones in my hands, I'm having arthritis. I can barely sit up. I can barely walk. Like, I couldn't walk. I was immobile for a number of weeks. So immobile that when I went back to urgent care because I felt something in my chest, and I went to urgent care to make sure it wasn't the abscess coming back, I was diagnosed with having a skeleton inside of my body because I was a bone. I lost so much weight during my time in the ICU and in my previous hospital stint, and in the few weeks since then, that we're at the beginning of April 2024 now, and I felt a bump of a rib cage bone, and I went to urgent care over that. Never said I was smart. Anyway, I was diagnosed as having a working body. Really cool. Glad to know that happened. But when I was at urgent care that time, they were just like, okay, could you move onto the bed? And I was like, no, I can't. I'm immobile. Like, I cannot walk. And they're like, well, can you stand and pivot and just move your feet a little bit? Like, if I could do that, I could probably walk. So yeah, it was just really bad. I was only in that hospital in the hospital that time for maybe an hour or two. And things ended up being okay. And then as I'm coming home and looking stuff up and wondering that sentence that the doctor said, antibiotics to bypass kidney and liver, I looked it up along with various other things, and I realized that I have the laundry list of post-sepsis syndrome symptoms. And that's when I really started to understand the chest abscess went so ignored because I didn't trust my own pain anymore, that it developed into being as big as it was and as problematic as it was. And it caused me to develop septic shock and die. Luckily, that nurse managed to get me to renew my subscription to life because I had just pieced right out of this one. And since then, since that April, I went from completely bedbound to being able to get up and use like a bedside commode, to being able to get up and walk to the bathroom on my own and stand like from the toilet, which was something I couldn't do before. You know, I was really struggling with that before I went into the hospital. And I really was starting to get my strength back, but one thing that I was struggling with was eating. And then I find out that gastroparesis, and like my digestive system was paralyzed, so I couldn't keep food down. It wouldn't stay down. And that led to me like, I'll do a weigh-in in next vlog that I do. But like the scale got down to 145. Like my goal weight so in reach. It's gone up a little bit since then, but if that was the one good thing that happened, is that I was kind of like gifted this, I'll take it after everything I went through. But the drawback of that is like, yes, I lost 60, 70 pounds in a very short period of time, but a lot of that was muscle. A lot of that was endurance. I'm having to fight to get my strength back. I was out of work for over a year. I've just barely gone back now, and it's incredibly part-time because I need to work on my strength and work on my endurance, my stamina. I barely got to the point where I haven't even tried running a mile, but I can walk one. It takes a lot longer than it used to. I'm not sad about that. That's just one of those things that it's gonna be. But I do feel like I have a new lease on life. If my life is broken down into two phases, then it's like, yeah, I have before septic shock and after septic shock. And I honestly did not know after septic shock was a life I thought if you had sepsis, that was it for the longest time. And I had no idea that you could survive. And I feel incredibly lucky that not only have I survived, I've made almost a complete recovery. I believe that I will make a full and complete recovery. And I made it with all of my limbs and all of my teeth, because those are things that people lose when they go through sepsis and septic shock. So I feel very lucky that it took a lot from me. It did not take anything from me permanently that I have found yet. And I'm finally starting to get back to like where I want to be in my life, with my life, how I'm doing this. So it's going to be a journey. We're going to figure this out. And if you stayed this long, thank you. I would say leave me a thumbs up emoji, but no, leave me your favorite emoji if you made it this far. But thank you for being here. I will definitely recap a lot more of what's been going on. And yeah, now we're in the second phase. So this has been the recap of the first. I know I glossed over a lot of things, but I think I talked about plenty about how I got to where I am here now. And we'll go over a little bit more in the future, okay? Okay, thanks for sticking around. Bye.